My name is Anita. I come from Austria. I already had the privilege to meet Miranda at one TC we had about learning about N trackers. So it's very new for me to be in this group, and that's why it's more important maybe for others that I get to know all of you, focusing specific on this kind of treatment. And that you get to know us as a community for children with cancer, or really helping families with childhood cancer diseases. I think it is something what is a little bit different because it's a Europe umbrella. CCI is worldwide, but we're focusing worldwide on policy and advocacy. But in Europe, we have to guide all our national members, and there are 66 in 33 countries. And all these gray ones are not members yet, but all these others are members from CCI Europe. And it means we more or less know all these members and try to guide them through everything what is needed. And there we have, in the EU, we are privileged, and I will come back to guide you through. These are continental branches. Of course, we do patient advocacy together, and we participate in EU-funded projects, what is very important because this is something where we work together very closely with the academia, psychologists, nurses. So it is a community in itself, but it is not focused on a specific disease. Maybe I can go back one slide. We also focus on research and innovation because it is in Europe that we have our own legal framework that we have to focus on. So, and in CCI Europe, we have a specific target group looking only on drug development and on pediatric regulation, that everything has to be changed from time to time, but it's on a legal basis in the EU Parliament. We also focus on diagnosis, treatment and care, on survivorship, and specific on psychosocial care. And I can guide you through our next one. It is something what we developed together with all European groups. It exists in many languages. It's the European Standards of Care. It's available on all web pages, on the academia webpage, SciOB, on our webpage, CCI Europe, that parents and families really can know what is the standard of care in all these levels, what you can see here, or all these areas, what you can see here. And for us, it's very important to educate the politicians and all these institutions where they in the countries where they are not so rich than for instance my country, Austria. Yeah, so we really try to get all our national contact points there to say, go to the government, lobby for that, and the European Standards of Care is one paper where they can do that. So this is something what is very specific in Europe. As I have mentioned, we have the EU Parliament, and the EU Parliament is giving a lot of money to the cancer communities. And they try, because childhood cancer is very rare, and some things are even rarer. That's why we had to find ways how to do and to serve our community. In all the countries, we have national contact points, and people, they are really focusing on this, working with us. And we built this European reference networks. This is an institution from the EU Commission. Yeah, so it is how to explain, the European reference networks is focusing on rare diseases And we tried to give to ensure that it's about cross-border health care, and a virtual community is taking care about all these rare cancers. For instance, one child in Bosnia and Herzegovina has a very rare disease, and they actually know then to whom to go to contact to get all this. Sorry, I don't know why it's going themselves. Why they to get all this knowledge that those community, the doctors know exactly what to do with this child. And sometimes they have to go cross-border, and this is everything organized and covered by us, supported by the EU, and supported by all these national contact points, also financially, so that we can be aware that the idea is that all the children gets the same treatment and have the same access to everything what is available for childhood cancer. Very specific, very privileged, but you know, for us as taking care for this community in childhood cancer, for me it's very specific also or important to listen to all of you, because what we don't have at the moment is, for instance, end trackers. We don't have it organized for childhood cancer. That's why I'm very happy to have parents here, because maybe this is something for the future, to have also a community focusing on end-track fusion positive children, because this is something what we are not doing yet. So I think this is something what we didn't discuss this in our community yet, but this is why I am there, therefore, to listen. Thanks.